My name is Dr. George Blackall, and I'm a pediatric psychologist in the departments of Pediatrics and Humanities at the Penn State Hershey Medical Center. This essay is entitled, Stand and Wait. Casey had a gift for raising the roof. I did not realize that the first time I met him, but I would soon find out. Previously healthy, he had started to feel lethargic 2 days earlier, and by the time he had arrived at the hospital, he was experiencing acute liver failure. As a newly graduated psychologist, my job that afternoon was unclear, other than to introduce myself to Casey's parents, offer a sympathetic ear, and hope that he would get a new liver real soon. Casey was placed on the liver transplant list, and miraculously, he received an organ that night. His surgery went well, and by Monday morning, he had been transferred out of intensive care to a surgical bed on the floor. I received a call at 11 a.m. from his nurses who were distressed because Casey was swearing and had threatened to throw a telephone at them. Before entering Casey's room, I read his chart and noticed that an order to decrease his morphine by a considerable amount had been written early that morning. Thinking little about that, I went in and introduced myself. He grunted and went back to watching TV. After a few minutes, I finally asked whether he was in pain. He glared at me, lifted up his hospital gown to reveal an impressive horseshoe-shaped incision, pointed to his wound and screamed, "Yes!" I called the surgeon, who explained that Casey had reported little pain that morning, so they had decided to decrease his morphine. The surgeon arrived in his room a short while later and increased his analgesic, and soon Casey was comfortable. After several months of doing well with his new liver, Casey arrived in the clinic one day with a large, golf ball-sized lump in his neck. There was a collective gasp throughout the clinic as staff realized what the lump likely meant. After a series of exams and tests, Casey was diagnosed with post-transplant lymphoproliferative disease. Despite the seriousness of this new setback, Casey and his family approached the situation as optimistically as they could, hoping for a miracle. That hope was short-lived. One Saturday morning, as he was being wheeled down the hall for magnetic resonance imaging, Casey experienced cardiac arrest. He was revived, but there was significant damage to his brain. By Monday morning, it was clear that he would not survive. When his parents were told that his brain was too injured to recover, they were given the option of removing life-sustaining interventions. They were gracious in their grief and decided to withdraw support, but they asked whether they could have some time to gather family and friends to say goodbye to Casey. I waited with them, spending most of that day either by Casey's bedside or out on the street where they would go for a smoke. By about 7 that evening, the family's pastor had arrived and Casey's room had filled with friends and family. I was standing alongside one wall of the room, feeling increasingly like there was nothing for me to do. I was hungry, tired, and had to go to the bathroom, so I offered my sympathies to Casey's parents one last time and went home. That night, every time I closed my eyes, all I saw was Casey's face. I tossed and turned, grunted and groaned until around 5 a.m., when I finally got up and went back to the hospital. I went straight to Casey's room in the ICU, and of course, it was empty. I spoke to a nurse who told me that he had died peacefully around midnight. I thanked her and went to my office. My restlessness continued as I sat there trying to figure out why I was so upset. Later that day, I met with a seasoned psychiatrist and told him the story. When I was done, he looked at me and said, "You abandoned the family." I recoiled at his bluntness, but I knew instantly that he was right. In that dark hour in the ICU, I had felt helpless and powerless, so I walked out. Sure, I had plenty of good reasons to leave, and the family probably did not need me there any longer. But the real reason I had left was because of my discomfort. I felt awful. The psychiatrist went on to tell me his story about when he was in training and caring for a dying patient and had walked out on that family. We talked at length about how hard it can be to enter a dying patient's room. Finally, he looked at me and said, "You know, George, sometimes all you can do is bear witness to a human tragedy, and that, in and of itself, is good enough." I still hear those words today, 15 years later, when I'm in a patient's room where there is immeasurable suffering and my impulse is to flee. I think of Casey and his family, and I remind myself that although I may feel like I am not contributing anything, I am sharing in a profound human moment. By entering that death-filled space, I validate a person's life and connect with the patient and their family around a shared struggle. The patient's struggle to die, the family's struggle with grief, and my struggle to be present. It is within that struggle, while I stand and wait, that I find that I have served my patient.